But dextrose has one that it has only to be used with, and that's amphotericin B. So amphotericin B, as I said on page 16, for fungal, it can only be given with D5W. So keep that in mind. Amphotericin B has some other qualities. It is photosensitive, sensitive to light, and then a patient needs to, the things are listed right there on page 16. There are 2 other newer drugs for fungal, for a fungus, and that's absat and abasone. And these drugs decrease potassium, so you'd want to watch that. And then you'll see it says mix with D5W only, and they're photosensitive. They are, especially amphotericin B is very hard on the nephrons, the kidneys. So before a patient gets amphotericin B, they flush them with normal saline or some kind of fluid to just really flush them good before they give them amphotericin B so it won't burn their nephrons. So I wanted you to keep that in mind. Calcium, I think we've already mentioned it, just want to mention it again. I think we mentioned it when we mentioned nutrition. But a serving of calcium, milk, a serving of milk is 300 milligrams. And our body can only handle 500 in 5 hours. And I think I talked to you about premenopausal and menopausal. And I know I did because there was a quiz on it. But just to remind you, menopausal women, 1,200 milligrams. Postmenopausal, 1,500 milligrams. But you can do it in 300 milligram servings, or take some kind of calcium tablet that equals that. I just wanted you to remember the roots of drugs and how we give them and what is fastest. And I think, and I hadn't necessarily seen it listed, but I think the fastest that a drug can get to you is probably sublingual. You put it in your mouth and it is into your system in no time. I think you learned that too. That'd probably be the fastest. IV's awfully close. So sublingual, IV, oral, sub-Q. Remember, sub-Q is not real fast because it's in the tissue. And then IM, and then probably intradermal next. So keep that in mind on how fast drugs are absorbed in our bodies. Sublingual, IV, oral, sub-Q, IM, intradermal. And intrathecal in the rectum is pretty fast, and it'd probably be right after oral, probably, the intrathecal. Which brings up, and I don't know whether you've heard of them, you know I don't go for slang terms, but they call it the poop pill. It's a transplant using fecal material. And I don't know whether you've heard of it or not. It's being done in Nashville. It had been done on my floor. But a friend of mine talked to a physician here in Nashville, and he says he does it when somebody has C. diff and their GI system is so torn up, so inflamed, in such terrible shape. They're cramping. 15 and 20 defecations a day. They need some help, and nothing is stopping it. And so here, the doctor in this city says he just takes fecal material from a family member, and I guess he treats it in some way, and then paints the rectum. That can be done that way. The way I read is that a family member donates their fecal material, and it is taken, the bacteria is cleaned, the food's taken out of the feces, the bacteria is cleaned, and then it's put in gelatinous capsules, just stuffed in capsules, and the person will take 24 to 27 capsules several times for a couple of days or whatever. And they have great stats on that their C. diff. They give, I read a statistic that of about 20-something C. diff patients, they didn't have any that had returned C. diff. Let me see if I can describe 27 patients who were treated this way on a Thursday, and they had suffered at least 4 C. diff infections and relapses, but none had a recurrence after taking the poop pill. So, you heard it here first that there is, they call it fecal transplant. So, you've heard of it, and I'm glad you have. Another thing that's new out, and some of you may have used them, is the bladder scanner. Rather than not sure if somebody's bladder's full, and catheterize them to find out and introduce germs, because I'm going to tell you there's no way, as sterile as you are, that you're not going to introduce some bacteria into a bladder. And so they have these scanners that can scan the top of the bladder just on the outside and can see if you have a full bladder or not. And some of you, I've already told you more than I know. That's just what I hear. I'm told about that. I want you to remember Ofirma, Ofirma, O-F-I-R-M-I-M-E-R, Ofirma, which is the IV Tylenol, and that's in the medication part of your briefs. Ofirma, Merv, or something like that. Look it up. But it is IV Tylenol. They say it works better than some of the narcotics. And it is used in Nashville some. The IV ibuprofen is Caldolor, C-A-L-D-E-L-O-R. It's also in your medications, C-A-L-D-E-L-O-R, IV ibuprofen. Just keep in mind, the granddaddy of all anticoagulants was Coumadin or warfarin. And then they went to Pradaxa. And I have people, I don't know why, Pradaxa seems okay, but people think it's just horrible. And you don't have to have your blood checked as often, but people who really work with people in DVTs aren't as proud of it as I would think they would be. Xarelto, X-A-R-E-L-T-O. X-A-R-E-L-T-O, Xarelto, is another anticoagulant that you will be using. I just wanted to make one comment on names of patients. We had a patient who had a difficult looking name, and so the student called her Miss whatever, first name, Miss Jane. Showed her respect, but just didn't even try her last name. And the floor didn't either. Everybody on the floor didn't either. And I told the student, I said, let's try to learn her name. To me, that shows so much more interest and care. If you care enough to ask somebody's name and how to pronounce it. I want to know how to pronounce your name. When the student worked with the patient, it was so simple because it was phonetically just each syllable. And it was such an easy name to learn. And I thought how many times people have not even tried her name because it looks so long and hard. So think about that. And are you just calling them Miss Jane because it's easier? Or do you care enough to try to learn a little more about their name? It happened to us, the students and I share it with you so you won't do it and be so conscious because it reminded us. Late in the day, we were asked if we wanted to start an IV or fix up the tubing for a patient, and we said we did. And so it wasn't our patient. We're kind of task-oriented, and so one or two of us went in the room, and she had a visitor, and the woman was from a nursing home, very contorted, eyes almost rolled back in her head, her tongue kind of sticking out. And we assessed right then that this woman wasn't with us. And it's just because of the way she looked. And so we went in and started working and really didn't speak. I'm not sure that we even spoke. We were just so task-oriented. And then we saw the woman herself, and we were just a quick job, just hanging her tubing. And so at some point the visitor, in a very scolding voice, said, "If you would tell her what you're doing, it would be nice." Bingo. We realized that wasn't a good thing to do. So the students, of course, they were jarred just like I was, because I didn't do any better than they did. And when we were getting ready to leave, the visitor called me over and said, "Do you not teach your students to speak to the patients?" And I said, "Oh yes, we do." And that just got by me, and I apologize, and so sorry, and thank you for bringing it up. And I truly meant that, because it just reminded us, we just get so caught up in what we're doing that we forget. The student, not real sure the patient knew that much anyway, but the visitor scolded us, and it was okay. It was all right to do. Now, remember on stool, vomitus, gastric, possibly amount, color, and texture. Always never have anybody ask, wonder what that looked like, or wonder how much. You want a chart in such a way that no one would ever have to find you to say, "Tell me more about it." It doesn't even have to be long. Just give them color, consistency, amount on any of this that you look at. Be real careful about IV solutions. 0.225 is 1/4 1/4 saline. 0.225. And remember, 0.455 is 1/2 saline. So don't forget those words. And when I lectured on hematology and Desferol, Desferol, it was the drug, and it's in your medications, that takes iron out. DE, like take for dehydration, it's take water out. For Desferol, it's DE for sol, taking iron out. Now, remember, it's in your briefs, Troche. A Troche, Troche, is a lozenge. When you see the word Troche, Troche. Pre-albumin and albumin, I think I have already told you, but I wasn't sure. I was looking through your briefs, and it's something I think is important, that when somebody's checking albumin, and we know how important albumin is with the osmotic pressure and pulling fluids through membrane. And so it's more accurate for the here and now to do a pre-albumin, because the word is, as I said, I may have already told you, that if you do an albumin, the pre would have been two weeks earlier. The here and